Hi, this is Imran Basha. Welcome to the channel TCM with Imran. I hope you are well and good. And today's topic is Introduction to Anatomy from the book of Vishram Singh. We try to study in a simple way and we don't need to crack our head. We'll start with introduction. What is anatomy? Generally, the anatomy deals with the human body or structure of the body, how the body is made up of, maybe it is a macroscopic to the microscopic level. Macroscopic is nothing but from the skin level to tissue level, or from the tissue to cellular level, that is called microscopic level. So basic definition which comes from the book is the anatomy is the branch of biological science that deals with the study of the structure of the human body. So this is a basic meaning. So what we understand here is what is the body is made of, and where each organ is located, and how organs, tissues and systems are arranged and connected. So this all we are going to study in the anatomy. So what is the exact meaning of anatomy? Means the word anatomy comes from two Greek words, that is ana, which means the up, up. Ana means up. The tomi means to cut. So both we combine to cut up. We have to reverse the word, to cut up, or we can say that dissection or something which is cutting. So originally the anatomy meant cutting open the body to study its internal structures. So in the ancient day, they were studying the anatomy by the cadaver section, they were having dead bodies, and they were directly cutting the dead bodies, and they will remove the organs from the body, and they will keep aside, and they will observe through the naked eyes. That phenomena is called as anatomy. So as per today's technology, we study the anatomy through cadaver section, one option, and models and specimens, and radiological imaging, X-rays, CT, MRI, ultrasound, like that, and also the endoscopy and 3D digital technology. Through this we study the anatomy. So what is the importance of this anatomy? Means this is the foundation of medical sciences, right? Without anatomy we can't study or apply the clinical knowledge to the patient without anatomical knowledge. So that is why very important is anatomy. In that we have a physiology also, how the body works, and pathology, how the disease comes, and medicine and surgery, and through that rehabilitation and physiotherapy also. For the physiotherapy people, the anatomy is the most important concept, and they need anatomy, and also other medical sciences also. So without the anatomy we can't suggest a treatment. So that is why it is very important. So how it will help to any kind of medical therapist or medical doctors or healthcare professionals. So for diagnosing the disease and performing physical examinations and understanding the injuries and planning and treatment of surgery, and provide safe patient care. So these are all the basic information we need to know about the anatomy and medical science. So how it is helpful for medical professionals. So there are, if you see here, there are some subdivisions of anatomy. So in this gross anatomy and topographical anatomy, both are same, and microscopic anatomy and surface anatomy, comparative anatomy and physical anthropology, living anatomy, so etc, etc. So what exactly is the regional anatomy? This is very simple. The study on cadavers by dissection and observation of a structure by naked eyes. For suppose if you have a dead body, you are cutting the dead body and you are observing the parts, and you are removing the organs, and you are observing the parts. That is through your naked eyes, and that is a gross anatomy. You are studying here is the anatomical relationship between the structures. So for example, arrangement of any kind of nerve or artery or vein in the particular area. For example, the femoral nerve or femoral artery to check the pulse, and vein in the thighs. So like that, these we need to know the where exactly it is situated or located. So why it is so important in clinical relevance, like important for lumbar puncture or nerve blocks and catheter insertion or IV cannula or injection administration. So these are many things are there. If you speak like for suppose if a surgeon is taking any kind of cerebrospinal fluid from the lumbar, from the disc, so for the sample purpose, so like that we need to know the anatomical region, right? So for that we need a gross anatomy. And also the simple example we can say, if the doctor is injecting any kind of medicine to you, so he need to know the where exactly he need to puncture or he need to administrate the injection, so where exactly it is safe or where exactly it is hazardous, so like that we need to know, right? So that is why gross anatomy is so important. And in the gross anatomy there are two types of anatomy, that is a regional anatomy and one more is systemic anatomy. The regional is very simple, like just now I said, the particular we are studying the particular regions. For suppose see this region, the head and neck region is one part, and thorax and abdomen is one part, and upper limb, lower limb is one part. We are studying this separately. So the body is divided into the following 6 regions. So we can see here head and neck, brain, thorax, abdomen, upper limb and lower. Exactly is the regional anatomy, the study of the body's region by region. So if any kind of surgery need to perform in the thorax, what exactly the thorax have, the lungs and the heart, so that is a different. And abdomen, what are the organs we have in the abdomen? So large intestine, small intestine, liver, spleen, these are the internal viscera are existed. So like how we are separating the regions and we are studying the regional anatomy. And the systemic anatomy, what is this systemic anatomy basically? So we are studying the systems. There are several systems in the body, like integumentary system, muscular system, nervous system, and cardio, lymphatic, endocrine, digestive, and respiratory, and reproductive, urinary system. So these are the systems are available in the body. So the definition says systemic anatomy, approach in which all the structure forming a particular system are studied in and gathered at the same time. So studying the whole system at the same time. For example, you are taking respiratory system and you are studying, and the systemic anatomy provides comprehensive knowledge of a particular system through the body. Hence it is most useful for physicians. What exactly we study in the systemic anatomy is that we study about the skeletal system, for example about the bones and skeletons, and muscular system about the muscles and tendons, and nervous system, brain, spinal cord, nerves, and cardiovascular system, heart, blood vessels, arteries. So example, and respiratory system about the lungs and airways, and digestive system about the stomach, intestine, liver, and urinary system about the excretion of the urine like kidneys and bladder. And also the reproductive system, male or it may be the female also. Endocrine system, that is related to the hormone secreting glands like pituitary gland example. And lymphatic and immune system like lymph nodes and immune organs about the lymphatic, that is a drainage system. So integumentary system is one of the biggest organ in the human body is the integumentary system, which means the skin system, skin or hair, nails, or these are called integumentary system. So why it is important in the anatomy in medical professional is helps to diagnose the systemic disorders like heart attack. About the, if you study about the cardiovascular system, you get to know about the how heart attack is coming, and if you study about the respiratory system, you get to know about the how asthma is attack, and if you study about the nervous system, you get to know how the person is getting paralysis or any kind of nerve injury, why the patient is getting the radiating pain or any kind of the disc prolapse due to that nerve compression. That is these are all comes under nervous system. So that is why we need to study all those systems in our body.
உங்க ஏரியாவா? இந்த ஏரியா, அந்த ஏரியா, அந்த இடம், இந்த இடம் எங்கேயுமே எனக்கு பயம் கிடையாதுடா. ஏன்னா ஆல் ஏரியாவிலையும் ஐயா கில்லிடா.